This video, we are going to be covering different types of congenital disorders. The first disorder that we're going to talk about is spina bifida. First, we're going to have to talk about the development of a back normal, what this normally looks like. So as you can tell with the first picture, around 21 days, you can see that the spine starts coming together. 22 days, it's continuously going, and around 28 days, that's when we start noticing if they have spina bifida. This is a neural tube defect, normally closes by day 28 after conception, and when it's not closed by day 28, they can usually see this in their ultrasound. A spina bifida is a birth defect that occurs when the spine and the spinal cord don't form properly. A diagnosis is usually found by an elevated maternal AFP level followed by an ultrasound. The AFP is the alpha fetoprotein, which measures the level of blood, and if it's elevated, it could be related to abnormalities, which is how we link it to spina bifida. There are three different types of spina bifida. The first seen is spina bifida occulta, which means hidden. So this is a small separation or gap in one or more of the bones of the spine. You have meningocele. With meningoceles, the meninges push out through the opening of the vertebra, forming a sac filled with fluid. There is no paralysis or sensory loss with this one. The myelomeningocele includes membranes and the spinal cord are pushed through the opening. This is usually exposing tissue and nerves. Although the cause is unknown, it has been linked to low folic acid levels during pregnancy. Some children are asymptomatic and others have severe neurological dysfunction below the level of the lesions. Open spina bifida can be diagnosed prenatally by an ultrasound or suggested by the elevated A fetoprotein levels. After birth, a lesion is typically visible on the back, and the treatment is usually surgical. Occult spina bifida is the least serious and most common type. It is usually discovered only on X-ray or scans. Most people never become aware of their condition. Meningocele is the next most serious type. Meningocele is the covering of the spinal cord, passed back through the opening of the spine to form a cyst-like swelling, where the myelomeningocele is if the spinal cord is enclosed in the cyst, that is when the condition is considered a myelomeningocele. This is the most serious type of spina bifida because it contains the spinal cord. So let's think about this. You have a baby born with a meningocele spina bifida. What can you do with the sac until surgery can be done? How would you want to position this child? So we want to keep the sac moist. We're going to do this with normal saline soaked gauze. We want to make sure it stays moist and we want to protect it. We are not to use any kind of alcohol or drying agents. How do we position these infants? They're going to be in the prone position. Remember, we don't want to put any pressure on their spines. We're going to keep them in the prone position. Some nursing assessments. We are going to assess for the neurological disabilities below the level. We are going to manage head circumferences. We're going to assess for bowel and bladder function, and we're going to watch for leaks, ruptures, or infections. Prognosis varies by the level of the cord involved and the number and severity of associated anomalies. Prognosis is worse for children with higher spinal cord levels. With proper care, however, most children do well. Treatment, there are different types of treatment. Surgical repair of the spinal cord. Sometimes there is a ventricular shunt, which we will talk about later. There are various measures of orthopedic and urologic complications. A myelomeningocele identified at birth is covered immediately with a sterile dressing. Remember that normal saline. If the myelomeningocele is leaking cerebral spinal fluid, antibiotics will be started to prevent meningitis. Neurosurgical repair of the meningocele or an open spine typically is done within the first 72 hours of birth. If the lesion is large or is in a difficult location, plastic surgeons may be consulted. Kidney function must also be monitored closely. Orthopedic care should begin early if there are any other kind of orthopedic concerns. Prevention and treatment is going to be, prevention is folic acid. That's why we have, that is why it's very critical for pregnant women to be on folic acid. Folic acid is a man-made form of vitamin B called folate. Folate plays an important role in the production of red blood cells and helps your baby's neural tube development into the brain and the spinal cord. I have posted a video about a spina bifida repair for you to watch. Next, we're going to talk about hydrocephalus, which is an obstruction of cerebral spinal fluid within the ventricles and subarachnoid spaces. It is most often associated with spina bifida, and it can be a complication of meningitis. This is a condition characterized by an increased cerebral spinal fluid in the ventricles and the brain. This also increases the intracranial pressure and increases the head size. So remember, with infants, their skull is not formed together yet, so their head can expand, as you can see in the picture above. This is the buildup of fluid increases, and the size of the ventricles increases the size of the ventricles and puts pressure on the brain. Cerebral spinal fluid is produced by tissue lining the ventricles, and the fluid flows into spaces around the brain and the spinal cord, primarily absorbing by blood vessels and tissues near the base of the brain. So hydro is ventricles widen, put pressure on the veins, and encephalitis is the brain tissue swelling. So if you put those together, hydrocephalus, hydro is ventricles widening, putting the pressure on the brain, and encephalitis, which we already talked about, is the brain tissue swelling. So what exactly am I talking about when I say it puts pressures in the ventricles? So if you look at the picture right here, you'll see the opening of what they call the ventricles. And what's happening is the ventricles start growing, and as those ventricles start growing, it is pushing the areas of the brain out. So it's making the brain wider as those ventricles become wider. So what are these infants going to look like when they have hydrocephalus? You're going to see they're going to be irritable and lethargic. They're going to have an increased head circumference. They're going to have bulging fontanelles. They're going to have widening suture lines. They will have sunset eyes. So if you look at the pictures, you can see that it looks like you have sunset. That's how they get that sunset eyes. Their eyes literally roll down, and you can only see it looks like a half of their eye. That's why they call it the sunset eyes. They can also have wide-pitched cry. The scalp veins are distended, and the scalp becomes a shiny appearance, as you can see in the top picture. It becomes that shiny appearance. Here are some nursing assessments in older children, a little bit different. A change of level of consciousness, irritability, projectile vomiting, headache upon awakening, motor dysfunction, unequal pupils, decline in academics, and a change in their personality. Here are some nursing interventions for y'all to look over. Talking about the pre and post surgical procedure. So the surgical procedure, the surgeon attempts to shunt or bypass the point of obstruction in the brain. So what they use is the excess cerebral spinal fluid is shunted to another part of the body and absorbed and excreted by inserting a special tube placed at intervals as the child grows. This is called the ventriculoperitoneal shunt. I've posted a video for you to watch that talks about hydrocephalus and how that treatment looks. These are the adjustable pressure valves. These valves regulate the flow of cerebral spinal fluid based on the pressure setting that can be adjusted. Using surgically designed magnetic tools, your physician can non-invasively change the pressure by setting of the implanted adjustable valve during an office visit. So with this magnetic, they don't even have to go in to surgery to reset that pressure. Some valves include a reservoir that can be used for a variety of reasons, such as flushing the reservoir. Your neurosurgeon can test the shunt function. He or she can also sample cerebral spinal fluid for the purpose of lab studies. They need to teach family the signs of increased intracranial pressure, infections, and we also want to have them watch for the abdominal swelling. These can be bulky. You can usually see them in the children. It's usually behind the ear, and some have a button that can be pushed. Next, we're going to talk about cerebral palsy. Cerebral palsy is a non-progressive injury to the motor centers of the brain, causing neuromuscular problems or of spasticity or dyskinesia. This is directly related to the low level of oxygen to the brain, which is found in blood. So it could be caused by anything that affects your blood flow. Your brain uses about 25% of your oxygen intake. Brain cells are very sensitive to the lack of oxygen. Cells use oxygen to produce energy, so the brain requires a lot of oxygen. There are 5 different types of cerebral palsy. First, you have the ataxic, which is poor muscle coordination, poor equilibrium, and unsteady gait with possible wide gait. You also have spastic, which is hypertonicity with poor posturing control, so their legs start scissoring over. They also could start walking or standing on their toes. They have persistent muscle contractions with potential development of contractures. They have rapid involuntary muscle contractions and relaxation. Rigidity is rigid posture and a lack of active movement. Athetoid is a constant involuntary worm-like movements that diminish during sleep, and they can affect facial, which means you can see drooling with these. You can also have mixed, which is a variety of all of the above. Some nursing assessments with cerebral palsy is a persistent neonatal refluxes around 6 months, delayed developmental milestones. They will have poor sucking and tongue thrust. They could have muscle spasticity. scissoring of the legs, involuntary movements, and seizures. Some may not notice until they start walking. Here are some nursing interventions. Biggest thing is we make sure the family knows how to do passive range of motions. We want to make sure that we're treating muscle spasms. But we also want to make sure that the family and child is involved in their own care. Lastly, we're going to talk about Down syndrome. This is the most common chromosomal abnormality in children. It is evident by various physical characteristics and by cognitive impairment. This results from chromosome 21. It is associated with maternal age over 35 and most often advanced age. Here are the nursing assessments that you will see in Down syndrome. A flat broad nasal bridge, upward outward slant of the eyes, protruding tongue, short neck, a transverse palmar crease, and a hyperextensible and lax joints. Here are some common associated problems with Down syndrome. Some nursing interventions. We are going to assist and support the parents, observe and monitor growth and development, collaborate with the RN for family teaching, assist family with feeding problems, monitor for cardiac difficulty or respiratory functions, coordinate with family and with an early intervention program. These families will need a lot of education and support.